Is your child complaining of knee pain that comes and goes? Are you at loss as to what could be causing their knee pain? Because you've had scans and they all seem normal. Hi there, it's Neesha from My Favorite Physio. In today's video, I'm jumping in to share with you 3 reasons why your child or teenager could be complaining of knee pain on and off that comes and goes. So here at My Favorite Physio, we see lots of school-age children and teenagers who play sports and come in with sporting injuries. We see lots of teenagers who come in complaining of knee pain. So what we would often find are 3 common causes for knee pain, and I thought I would jump in and share that with you. The first common cause for knee pain is growing pains. This is the type of pain that your child will wake up screaming and crying in the middle of the night, telling you it hurts, and they're rubbing their knees and telling you to please rub them, mommy, please rub them, daddy. And you'll find yourself rubbing away on their knees, and soon they fall back to sleep again. And you think everything's okay, and then the next night it happens again. And they can go through cycles of this. Now, if we carry out full assessment and there's nothing broken and there's nothing sinister, and when we have a feel of their muscles and everything feels right, and they're at their age group where they're having a growth spurt, then growing pains is likely to be the cause, especially if it's at nighttime and they wake up crying and asking you to rub their knees. This is simply that your bones are shooting up and growing very fast while the ligaments and muscles are not stretching as fast, and so they get this almost sore, achy stretch pain through their knees at night. If that's the case, you might find that having your child have a hot bath once or twice a week might help ease that muscle tightness and settle that night growing pain that they complain of. Number 2 common cause for knee pain is Osgood-Schlatter's, and this happens in the teenagers who are running and playing sports a lot, and they might be really tight in their muscles. And what happens is that huge tendon muscle across your kneecap is pulling so hard because they're doing a lot of sports, jumping activities. You will find that that tendon is pulling on that bone on their shin. So that shin bone is now being aggravated. There's inflammation right at this point. So if you have a look at your child, you'll see that right below the kneecap on that bony bit, it seems to be very big and swollen. And if you touch it, they're really tender. That is actually an inflammation that's happening at that point where the patella tendon, the kneecap tendon, is inserting into their bone. It's called Osgood-Schlatter's, and you'll find that if they have a busy day jumping, basketball, and high intensity sort of activities, that's when it hurts the most. They would have to take a rest from their activity, and that could be even long distance sprints and runs that they might be participating in. They need to rest from their activity, and they would benefit from some physiotherapy to settle all that inflammation. And often, it's looking at the rest of the leg to make sure that there's nothing else that's actually aggravating that condition. Now, the 3rd common condition that's causing knee pain is often actually overuse injuries, muscle tightness in the back of their calf muscles, on the back of their thighs, and in the front of their knees, where all their quadriceps and hamstring muscles on the back and calf muscles on the back of the leg, they're all too tight and overused, and all those muscles insert around the knee, and that is actually causing a lot of swelling and chronic inflammation in their knee joint. So you'll find that when they squat, they bend, they climb up and down stairs, or they run, they're complaining of pain, and often you might see them limp off the sporting field because of the pain. If that's the case, what your child truly needs is an expert pediatric physiotherapist to carry out a thorough assessment of their muscles along their knee joint, above and below, for us to actually treat what is tight, what is overused, treat whatever chronic swelling and inflammation that's in the knee joint itself to help settle that knee pain. So if you would like to see one of our expert pediatric physiotherapists for your child, why don't you ring us here at My Favorite Physio? The number to ring is 02-9790-4233. And if you know somebody out there who has a child who's been complaining of recurrent knee pain, you've tried all sorts of remedies, you've seen all sorts of therapies, and it just isn't getting any better, why don't you like and share this video with them? Until next time, have a great day. Bye.